The study has revealed a significant link between menopause and mental health issues for Australian women. For more, we're joined now by Dr. Sneha Wadani. Welcome to you in the studio, Sneh. Okay, so what did they find in this study?
So it's interesting. This study actually looked at the prevalence of serious mental health presentations and admissions to hospital, and particularly around those kind of bipolar disorder, schizophrenia and severe depression. And what they actually found was a correlation between women of menopausal age and a spike in these presentations and admissions to hospital. Now, what the study is not telling us is that menopause causes these illnesses. But what it certainly does tell us is that actually if you are more vulnerable or more at risk of these conditions, perhaps there's been mental health conditions before, then we perhaps need to be a little bit more vigilant and proactive in this space. Because obviously if the hospital admissions are going up in that space, there is also a number of women out there in the community who don't meet those severity markers, absolutely, who aren't being admitted but are still suffering with symptoms. And look, certainly from my rooms, I would say, anxiety and depression are one of the earlier markers of perimenopause that we see before things like hot flushes and the like come into the picture. So I do think we need to address this sooner rather than later.
And talking about it is part of it, right? And that seems to be, outrageously, a reasonably new thing that we're talking about this openly. Absolutely.
And I think, look, a lot of great work has happened in this area. And just last week, the government has announced and launched, a education campaign aimed to really disrupt that misinformation and disinformation that we're seeing in social media and open this conversation amongst all of the conversations around menopause and perimenopause, which is just so important.
Yep, and if you need to, go and talk to your doctor about
100%.
what you're going through. Okay, talk to us about this other study, learning more about the importance of strength training. Now, this study claims that you can lower your chance of death by 20% if you do between an hour and a half and 2 hours a week of strength training, which feels like an amazing amount.
So it's not all new news, really. And what this study does tell us is that the addition of strength training on top of cardiovascular exercise certainly can give you greater benefits in terms of reducing your risk of death from cardiovascular related conditions and also brain related conditions. And as you say, it's that, an hour and a half to 2 hours of additional strength training on top of the cardiovascular work. But I think the important thing with this study is it was a large study. It did look over 30 years, but it did look also at people who were relatively inactive and started a program around the age of the mid-50s. So if we are actually starting exercise earlier and we're using a combination of cardiovascular plus strength training, we're really getting the best outcomes here.
Whoever would have thought that exercise and diet contributes to your longevity? All right, excellent. We've got a study to tell us now. Sneh, thank you. We love seeing you. Thank you.